So I'm here to welcome Mrs. Katie Regelsberger. Katie has traveled here from Indiana. She is the CEO and instructor of KLR Pharmacy Technician Certification School and KLR Certified Billing and Coding Specialist School. Katie's school is a school that is offered online and is now extended to over 11 states. So please help me welcome Mrs. Katie.
Hi, you guys. I speak with students all day long, every day. It's a little different to be up here in front of you, so you will have to excuse me if I am a little bit nervous. So I have been a pharmacy technician for almost, I want to say 13 or 14 years now, and I actually have heard a lot of you talk about how you became a pharmacy technician and why. I actually just was looking for a job that would pay the bills, and I knew nothing about being a pharmacy technician. And I started out at CVS, where I worked my way up to lead technician and inventory specialist, and I spent quite a few years there before I moved into the hospital setting at Riverview Health, where obviously, as you guys know, inpatient and retail settings are just completely different. So again, knew really nothing about that, but worked my way up, did all the basic training, med history, chemo, and IV, and I really loved it there. Joined the local hazmat team, which served all of the surrounding counties. And then in 2016 was offered a position as a pharmacy supervisor, where I was in charge of 30 plus technicians and 8 different roles. From there, I don't know if any of you are familiar with the Excel Center. So there's lots of people in lots of different states here. The Excel Center is a high school for adults, and it is actually the high school I graduated from, and that was in 2014. In 2016, the Excel Center called and asked me if I would like to take the pharmacy technician certification course, or if I would like to teach it. And I told them I'm not a teacher. That is literally how this all started. So in 2016, I started our first course, actually teaching in person for just a few different schools and 10 or 11 students. That quickly escalated. As soon as COVID happened, they asked if I could teach that course online, and that sounded a lot more fun to me anyways. So we started teaching that course online, and that gave us the opportunity to kind of go national with it. And so since then, it has been almost 4 years, and we have just really exploded, and working with those students to really give them an opportunity to earn a credential that is going to give them a great career with good benefits and good pay. Those students from the Excel Center generally have backgrounds where this might not be an option for them if they weren't going through this process. So that is something I'm really passionate about. We did just open KLR Certified Billing and Coding Specialist School as well. If you are interested in any of the information about the course, you can reach out to Allison Hardy, our Director of Administration back there, and she can give you that information. So basically, guys, this is going to be a super basic overview. You are all been technicians for years and years, way longer than me, so I can't even imagine the things I could learn from most of you. However, I think especially, Judy talked about, different roles that pharmacy technicians can get into and different ways we can go and expand into these roles. And then we were talking yesterday a little bit about how we are adding responsibilities as pharmacy technicians and doing new things and hiring all the time and really wanted to keep those employees. And so sometimes I think that we forget that as we're adding those new technicians to go back to the basics. And so that is what this is. So really understanding the differences between each drug enforcement agency drug schedule and why each drug fits into the respective categories, reviewing examples of medications in each drug schedule, and reviewing relevant federal law surrounding the use, storage, and dispensing of controlled substances. And again, super basic, but I think that as we bring in those new technicians, it's important to go back to the basics and remember those things. So the Drug Enforcement Agency, or the DEA, regulates controlled substances at a national level, but each state also regulates controlled substances through state boards of pharmacy. Important to remember that when we are having differing laws, to follow the more strict law. I always tell students that's really important. Again, guys, this is, all of you are very familiar with this. But Schedule I medications, those medications that we see on as our street drugs, marijuana, ecstasy, heroin. Anybody else know of any more right off the top of your head? Opium. And then Schedule II or C2 medications, those medications that we're really trying to make sure we are dispensing properly and that have all of these regulations. I always tell students those medications ending in codone are obviously your big clue. Those are always Schedule II medications. Your cocaines, fentanyls, hydromorphone, methadone, methamphetamines, and morphines. In KLR Pharmacy Technician Training School, that's always something, and something for new technicians. I did not know that when I started out as a technician, that the cocaine is a Schedule II medication, but marijuana is a Schedule I medication. So going through the differences of that, I think, is interesting for new technicians, something that a new technician isn't going to know walking in, right? Your Schedule III medications, I always remember those as the anabolic steroids, dronabinol, ketamine, and testosterone. Schedule IV medications, this is a big one that we do in class that is always, the students are having a really hard time remembering these. Those benzodiazepines are always going to be your Schedule IV, ending in PAM or LAM, OPAM or OLAM, and then as well as phenobarbital, phentermine, and tramadol. And then Schedule V medications is another one that is commonly confused. So those Schedule V medications are, you guys are very familiar with them, but they're going to be those antidiarrheals or those cough syrups. And those medications in some states do not need a prescription. And that, those exempt narcotics are sometimes very confusing for new pharmacy technicians to remember and kind of understand why. So noting that medical marijuana is still a Schedule I medication, because although a lot of states have legalized marijuana, physicians do not prescribe it. It is purchased in a dispensary. And then your Schedule II medications are highly regulated, and in addition to federal laws, many states have additional regulations that must be followed. Some states do allow emergency prescriptions for Schedule II medications to be phoned in and received by a pharmacist. Prescribers are required to provide a written, signed prescription within 7 days in those cases. And in those cases, only the amount needed for that patient at that time. Schedule III medications, the big one here is your codeines and your anabolic steroids, which are synthetic steroid hormones that resemble testosterone in promoting the growth of a muscle, used medicinally to treat some forms of weight loss and sometimes illegally to enhance physical performance, like testosterone, oxyldronolone, and trenbolone. And then your Schedule IV medications, having obviously that lower potential, but include your benzodiazepines. Again, that OPAM or OLAM, I'm always telling students to keep that in mind as their clue for those benzos. Benzodiazepines slow down messages traveling between the brain and the body, and they're minor tranquilizers and usually prescribed to relieve stress and anxiety and promote sleep. They're associated with dependence and withdrawal symptoms even after a short period, and sometimes are used by individuals to help with the come down from stimulants such as amphetamines or cocaine. And again, even though all of you know this, your newer technicians coming in aren't going to know these things, and keeping in mind clues to help them process that and understand it, I think, is important for us as seasoned technicians. Schedule V medications. Again, the exempt narcotics, this is something that I think I go through just so many times in an 8-week class to get people to understand this exempt narcotics. And even guys like which schedule is the least serious and which schedule is the most serious. And again, as a new technician, you don't know those things. So CARA is actually not something I am completely familiar with. We do talk a little bit about it in our class, but the Comprehensive Addiction and Recovery Act, also known as CARA, is that federal law that was initiated in 2016 due to the growing opioid epidemic in the United States, which you are all familiar with. This law supports a targeted approach to dealing with the opioid crisis and includes key areas including prevention, treatment, and recovery. It increases educational efforts for the prevention of substance use disorder and promotes treatment options and medication disposal sites. I think going through something like that with a new technician talks about why we cannot take medications, how we dispose of medications that are brought back to the pharmacy, things like that. And then e-prescribing. At the federal level, the Drug Enforcement Agency permits a prescriber to send a Schedule II medication to the pharmacy electronically, but they do not always require it. And federal law allows a fax to serve as an original written prescription for Schedule II medications for hospice patients or those in long-term care facilities. Gabapentin is an interesting one for me. How many of you are doing gabapentin as a controlled substance? Yeah, at the hospital pharmacy, we had started that back in, I think, 2015. But not everybody, obviously. So gabapentin is not a federal Schedule V controlled substance, but as of 2020, 7 states had listed it as a Schedule V, and 12 other states had placed gabapentin in their prescription drug monitoring programs. Gabapentin is the 6th most prescribed drug in the United States, which I did not know that. Prescribed for numerous reasons, such as various types of pain, restless leg syndrome, hot flashes, insomnia, anxiety, and some mental health conditions. It is known as an opioid potentiate because it can increase the high felt with opioids such as fentanyl and oxycodone, and even heroin. So storage of controlled substances. Schedule I controlled substances are required to be stored in a securely locked cabinet. This is another one I talk to my class quite a bit about, is where these are being stored, especially Schedule II medications, because those Schedule II medications, sometimes in some pharmacies in some states, I know in our state, they can be stored around the pharmacy. They don't have to be completely locked up. And a lot of times the pharmacist is really choosing, or CVS or wherever you work is really choosing which ones can be out and which ones cannot. When I worked at CVS, all of our hydrocodones and things like that were out in the regular stock, but fentanyls and things like that were definitely locked up. Inventory of controlled substances is another one that your new technicians are not going to know anything about when they're really coming in. They're going to know those basics if they've taken the exam, right? If they've taken the PTCB or the NHA, they're going to know the basics, but they're not going to know, how your pharmacy works or laws specific to your state. The exams are not state specific. So inventory of controlled substances in Schedule II must be exact. We have to know our exact numbers on those, but those 3 through 5 medications can be estimated, though most pharmacies do choose to keep an exact inventory of those. And then inventory of all stock of controlled substances on hand must be taken every 2 years. I remember when I started working in the pharmacy in the hospital and we did our first inventory, and all these people came walking in suits, and I was like, what is going on here? And so you just don't think of those things, and it was so serious, right? Our director was like, everybody needs to be on their best behavior and make sure there's no food out and blah, blah, blah. And so those things, your newer technicians are not going to know about that, and it's our job to really make sure that we're teaching those things and making sure that they feel comfortable in their workplace. And once they know those things, then they know they can come to us and ask questions. They're going to potentially learn more, right? They're going to ask questions and know more. Schedule II controlled substances can be ordered by filling out a Drug Enforcement Agency Form 222 or electronically completing the DEA Controlled Substance Ordering System, or your CSOS. For the paper form, a maximum of 10 items per form may be ordered. That's something that's actually on the national exam that we're We're big on that question in class. And only individuals with the power of attorney may order Schedule II medications, and more than one individual in a pharmacy may be given this authorization. Again, as a newer technician, not even newer, even when I was a supervisor, I didn't learn that until I was a supervisor in the hospital, because, right, it wasn't a technician duty. But then as my role grew as a supervisor, and I was more, speaking with those pharmacists who were doing those things, but I didn't know that. So Schedule 3 through 5 controlled substances are ordered in the same manner as non-controlled substances. The pharmacy must maintain receipts and invoices that include the non-controlled substance name, number of dosage units in each container, dosage form, and number of containers ordered and received. But making sure that those newer technicians understand how the process works for checking those in and the signatures that have to be done and things like that. And guys, I did not have an hour-long presentation for you. I'm not going to stand up here and bore you about things that you already know. My main topic is to make sure that we understand that as we're bringing in these new technicians and as our roles are growing, one of our roles that is growing is training and making sure that we're building great teams and making sure that those newer technicians are comfortable coming to more seasoned technicians and asking questions and feeling comfortable in their workplace to do that so that we can ultimately provide the best care to our patients. And that's all I've got for you.
So I'm from Washington State. Have you been to the state and seen the hot shops, as we call them?
No, I have not.
Because he started out with, he followed more strict rules.
Mm-hmm.
But in Washington, what we call the green hot shops, they're now putting security on the doors to the shops because people have been breaking in and doing the crash and run. And they're usually in like a small house size, one room thing, and it's just wall-to-wall product, gummies hanging. Almost nothing is locked up.
That's crazy. I have never been in one, to be honest.
Some have guards, or some have locked doors.
Wow.
Colorado has guards and takes your driver's license.
Where at?
Colorado.
Colorado, okay.
Is Washington, and
Indiana's not like, we're way behind, so.
I'm just curious, wondering whether I should go find out what it takes to get a job with one of these.
Tenders and they have licenses.
Yeah, it would be interesting.
I don't know what Washington is.
That's interesting, yeah. Yes.
Just a clarification, someone asked if opium was a Schedule 1 or 2.
It's a 2. I know, I thought about that after I was looking at the screen. I was like, whoops.
You don't see a lot of it in a community pharmacy, but it is pretty regularly dispensed in hospitals.
Yes, yes. Why is tramadol now scheduled and it was before? Well, guys, I don't know. Which one of you know?
The same receptors as opioids, and it does have to be split in.
Kind of like the gabapentin. Yeah. I remember when it went to a schedule, we did a tramadol cake at work to say goodbye to it. All the pharmacists were thrilled. We did a party.
The drug reps used to go around saying, oh, you just need to get all your Lortab patients on this, and they won't abuse it at all.
See how well that worked out for him. My training program is 8 weeks long. We teach that class 5 times a year. So it's 8 weeks long, fully online, but it is instructor-led. So it's not like they're just getting modules and going through it. I teach the classes myself, and we meet 3 times a week for 3 hours each day on Zoom. So the course includes their exam. They take the exam. That's how they have to meet certain requirements to be able to take the exam, the national exam. And then once they pass it, they'll meet with Allison to do their licensing. So they're in the course, nationally certified and state licensed. Yes?
The gabapentin's now a Schedule 5 in certain states.
In certain states.
How many states is it? Because I had heard that would be the next one to go schedule, but it's not in Florida. How many states have it Schedule 5?
Well, I think it said as of 2020, there were 7 Yeah, 7 states have listed it as a Schedule 5, and 12 other states had placed gabapentin in their prescription drug monitoring program. So it's getting there. I'm assuming so. I know in Indiana, where I feel like we are behind on everything, it's headed that way with gabapentin as well. Anything else? Thank you guys so much.